special appreciation to the guest speakers, Dr. Marcela Tseno, Dr. Suleiman Shelay, and thank you, Dr. Ingrid Vasiliou Feltes, for sending the video presentation. The topic for our second panel will be on privacy, trust, and self-sovereignty in digital health, and it is my pleasure to introduce our guest speakers. Our first panelist is Mr. Aman Quadri, connector and strategist by nature, who has been afforded great opportunities with MSIS to bring about change through his work. Currently immersed in fintech, healthcare, emerging technologies, he helps their lead global teams through their own developments as well as those for clients. Please, Mr. Aman Quadri, can you share your opinions about the topic privacy, trust, and self-sovereignty in digital health?
Hello, everyone. Good afternoon, good evening, good morning, wherever you are. It's nice to be here. Nice to be with the other panelists. Good to see you again, Shiv, right? Last time we were on a panel together, so it's good to see you. This topic is near and dear to my heart. I have been a practitioner mostly in healthcare for 20 years, and then a technologist for another 10, and then overlap them together. And really, my goal in life is to how to bring technology forward into the healthcare space through things like what we discussed today, like telemedicine, through data aggregation, through bringing in different solutions for different pathways. And so our company is a family-run company based out of Houston, Texas, and we've grown it from what was next to nothing to a multi-million-dollar company, but our whole focus has been on how do we impact those that do not have access to the same things that other jurisdictions or geographies do. And so I lead our healthcare portfolio, which includes 3 companies. One is medication data as a service in the United States. So we work with different healthcare organizations in population health, as well as what we call MTM programs, large pharma companies, and bring them medication data to allow them to enact change in healthcare around things such as opioid abuse, around things such as duplication of drugs, around even things on identifying medications that could be counterintuitive to each other, right? And so we have developed a platform that allows us to get medication for 250 million plus people throughout the United States and leverage that data appropriately. And the other part of it is the MChart initiative, where we've created data aggregation throughout multiple geographies, primarily in India, but we also do some work underground between Malaysia, Thailand, and a few other geographies, and going into Africa and even Central America. And the goal for that data is twofold. One is to bring it to bear to be used for new drug development, new development around interventions. But also the other part of it is that we want people to know that their data belongs to them. And how do we create pathways for those that create the data, which is the patient, to be able to benefit from that, not only physically, but potentially even financially. So ownership of the data, wherever geography you're in, is our sole goal. And I also lead some things. I know it shows that as a strategy officer for Fair Fintech, but I also lead our data and strategies around bringing financial literacy and financial banking to refugee populations, immigrants, and those that are pushed aside because of that. So I believe data is important, whether it's health or financial, and how do I get people to own that data long term? And so I'll stop there and then let everybody else introduce each other.
Yes, thank you very much, Mr. Aman, for your very informative presentation. Now we are moving to our next panelist, Mr. Shiv Aggarwal. He's a technology entrepreneur with a focus on improving human lives through the power of technology. He's currently leading Earth ID towards building a decentralized identity management platform with a vision of providing a self-sovereign identity to all human beings. Shiv is also the Europe lead and UK chapter president of Government Blockchain Association, a global nonprofit organization with over 100 chapters across the world, helping governments understand and adopt blockchain technology. Mr. Shiv, please go ahead with your presentation.
Thank you very much. Hello, everyone. I'm Shiv Aggarwal. I lead Earth ID, which is, as explained, it's a decentralized identity management platform. And then the key focus is basically about decentralization of the identity data. It's about empowering people with the privacy, consent, and data ownership. it's also about driving social and financial inclusion, because I think digital identity is very, very crucial with respect to empowering people, and that is what the focus of Earth is. Obviously, we are also focusing on organizations to help them reduce friction with respect to exchange of identity information, with respect to onboarding and identity frauds, and then also helping them save time and cost with respect to the overall identity management, right? And that is where Earth ID is championing the concept of self-sovereign identity, which is about a user-centric identity where the user is in complete control of their identity, but they are then able to basically share their information with different organizations, including healthcare, and then basically allowing for certain services, right? And when we talk about healthcare industry, I think it's very, very crucial discussion, and I'm so happy that I am here to basically participate in that, because what has happened is that because of the pandemic, I think we have accelerated the growth, the acceptance or adoption of technology. We are seeing a boom in this with respect to telemedicine and then online platforms, and it is changing the habits of how people are engaging with healthcare service providers, with medical professionals, and that is where it is also putting them to risk, right, with respect to cybersecurity, and also the data is also being put to risk with respect to being available online, and that is where our technology becomes very, very relevant and very, very important. You can think about it from different perspectives. You can think about it from the perspective of the identity of a doctor, the identity of a patient. You can also think about it from a perspective of how do you digitize the medical health records. You can also think about with respect to how do you address the question of data ownership, because I think within the healthcare industry, there's a huge debate and question around who owns the medical data, right? Is it the patient? Is it the doctor? Is it the laboratories? Is it like the hospitals? And that is where that question becomes very, very paramount. And then we help address that question with respect to who owns that data, and then how that data sharing happens, and how that data monetization happens, right? So this is where basically the key concept is, that how do you address first of all the ownership concept, and then drive privacy and consent, so that data with a specific purpose can be shared. So that's about it for now.
Yes, thank you. Very, very instructive presentation. Our third panelist is Mr. Charles Dunham. He's a healthcare attorney at the international law firm of Greenbreg, Traurig. He advises an array of healthcare providers, suppliers, and other health-related entities with a distinct focus on laboratory diagnostics, telehealth, medical devices, and digital products. He provides legal counsel in corporate, regulatory, transactional, reimbursement, privacy, and compliance matters. Mr. Charles, this topic seems very related to your work. We'd like to hear more about your experience.
Thank you, and hello, everyone. I appreciate the opportunity to speak with you on this panel, and I obviously am coming at this from a different perspective, so hopefully a valuable perspective. It's excellent to hear all of the health innovation and ideas. I have the privilege of contributing in my own way through legal counsel, through thinking through that transformation with my clients, both in the US and internationally. As indicated, and we have a firm of 2,200 attorneys with offices internationally, not only in the US, but in Western Europe, Asia, South America. And so we have a lot of work in the space of telemedicine, medical devices, digital health products. I lead our telemedicine and digital health and health innovation group here. And I think I heard one of you are from Houston, Texas. I'm standing right now in Houston, Texas as well. Came from New York, but have been here for about 5 years now. And so that I'd like to hear that connection there. On our end, we obviously all saw the healthcare providers from large hospitals and health systems down to just small group practices jump into utilization of telehealth, telemedicine, digital health products, and open that door. I saw a lot of activity with my clients on really pivoting to respond during the pandemic for clinical research. And in that setting, many of you probably had that same experience. And we saw and are still seeing extreme and significant amounts of investments in this space. startups and health innovation, but also just acquisitions. And we're working a lot with private equity, venture capitalists, and even family offices looking to invest in the healthcare space. Specific to what we're here to talk about today is a part of all of that has that legal and regulatory framework of privacy protections. I look at in that lens. I look at it in two ways. Namely, it's the ability for all of the players within the healthcare system to be able to share that data and health information to those health innovations require that sharing of that data, but it's also balanced with consumer protections is essentially what most of these laws are, whether they're in the U.S. or internationally, and to protect privacy. We look at it a different lens, right? That say we look at commercial or consumer data differently and protect health data differently. And so, so understanding that, thinking about that in those ways, we are right now faced with a situation where all of the waivers of those protections, all of the enforcement discretion of those protections will be soon ending, and how they otherwise play out with all of the healthcare providers and investors and new players within this market who jumped in, who need to understand that the compliance issues, and probably that from that perspective I come in, it's a significant burden, and so understanding that better, advising my clients better, and is something where I can come in and provide that perspective to this panel discussion. So look forward to further comments and questions and dialogue on that.
Thank you, Mr. Charles, for enlightening this very challenging issue and for your perspective on this issue. Our next panelist, Dr. Ali Hojjati, is currently lead advisor, healthcare improvement consultant for Accreditation Canada. He has a clinical background as a physician and has delivered surveys, training, consultation, and advisory support to Accreditation Canada clients worldwide. He provides survey training programs and trains new surveyors for Accreditation Canada and national accreditation bodies in other countries. As Accreditation Canada lead advisor, he also supports and leads all AC international advisors worldwide. Dr. Ali, the floor is yours.
Thank you, and thank you for this opportunity to be here. And then honestly, I'm not a technical person. I don't know a lot about IT, and I learn a lot. And you gave me a lot of idea for the further consultation with our clients worldwide. So based on everything I heard today, maybe I can start with a scenario maybe in 2-3 years from today. Imagine that you need a doctor and you go to the Amazon clinic, pick up one of the doctors in other country, 1,000, 2,000, 20,000 kilometers far from your home. And based on the review of other patients, based on the culture, based on the language, based on the cost, based on the availability and the specialty you want, you pick that doctor. And then with a lot of POCT devices or AI or devices for example, 3 leads, the EKG or some blood test is possible with a lot of simple equipment. The doctor can see the result, and in 1 hour you receive a message from Alexa, your medication in front door by the drone. It could be scary, but it's a reality in future. So in this way, we just talk about a lot of challenges in this kind of the digital healthcare services around the world. A lot of think about the privacy, about the ethical issue, and about the trust. So this kind of the idea in future, definitely they move the border of the licensing. Who can decide which doctor has a license in which country? With the new approach of the WHO and other organizations around worldwide, the patient at the center of the care and the ownership of the data and the health. So who can say to the patient that, okay, this doctor has not licensed in this country, but the patient, right. So a lot of challenges in future about the quality, about the licensing, about the trust, because when you talk about trust, you talk about the quality. And because of my expertise in the quality, I want to say that definitely this new approach in the healthcare delivery increase and make it much, much better than accessibility for a lot of people. And the accessibility is not only the physical environment, it's talk about the time. I need a doctor at 2 a.m. and I can contact the doctor in Philippines 2 p.m. over there. So about the language, because if I cannot connect with the doctor, and there's a lot of immigrants, a lot of countries, they have this challenge. So they are in the big cities, but they cannot communicate with healthcare providers because there's a barrier. So about the culture and about the cost, because sometimes the cost is very expensive. And then we started this kind of the solution for the health tourism about the cost. The people travel from the Western country to receive the same service for the cardiac surgery because of the cost in another countries. So, and as you all of you mentioned, these COVID pandemic just expedite the need for the global health, and it's just happened and never back to the previous before the COVID, and it could be more and more. But we need the unique data, unique patient file, and then who is the owner of those data, how you can keep and share this info. There are a lot of challenges in future. So, and then when you go with AI and then some kind of the robotic surgery is beautiful picture we saw today, that one also could be more and more in future. And then the ethical issue and legal issue could be a challenge. So definitely this kind of the approach, they have a lot of pros and cons. You cannot say everything perfect. When you talk about quality, usually we need to talk about quality dimensions. Definitely is increase the accessibility, make it better efficiency because it's cheaper. It's a work-life balance. The employee is more relaxed. They have not a stress running every time because the patient distributed worldwide. Is increased the lot of things like a client center and population focus. For example, the people in the local area and the rural area, they have not access to healthcare services as the other people. So this is a population need of those people they can answer. But at the same time, we have some cons for this one. One of the main concerns could be appropriateness and effectiveness of the care. Because when you have not the human touch and we have not the same contact with people, could affect the effectiveness of the care, and effectiveness is one of the quality dimensions. And the most important part of the quality, because again, I'm the quality expert, I like to look at that these services by this lens. What about the safety? Because the safety, patient safety, is one of the most important part of the accreditation and quality. Because definitely when you have this kind of the remote connection, the patient identification could be an issue. How you know that this is a real patient? The data and identification really happened, come out with this specific patient, because later it could be some kind of the fraud, some kind of the needs for insurance companies for other countries. You don't know. So this could be another challenge. So it is not the meaning that we cannot go for digital health. Definitely we cannot say no, but I think all of you expert in this field and technical part, in future we need to think about these challenges, because this could be more and more in future. And also it's not only the healthcare service providing. When we talk about the digital health and trends, a lot of other aspects it's coming soon. One of them could be the vaccine passport. Vaccine passport are the apps for a lot of countries that in Middle East, some of the countries, the people, they need to have a specific app to show the color on the mobile, so you can go in the mall or restaurant. So it's like a moving health status of your body is in digital. So these kind of or in the European Commission, they are talking about having the one passport for the travel between different part, or international aviation companies talk about this digital passport or digital vaccine. So all of them different aspects of digital health. And I'm sure that this topic, a trend in digital health, is not easy to discuss in different aspects. It at least needs 2-3 days detailed conference to go for all of this kind of aspect: quality, safety, availability, accessibility, challenges in future, and possible scenarios. So thank you very much again. I know with the time limitation, I cannot talk more about those topics, but I try to share with you my idea about the quality point of view, safety, and this new trend in digital health services. Thank you.
Yes, thank you very much, Dr. Ali. Accreditation is important for many health institutions and health professionals, and your presentation has been very helpful. So now we are going to continue and discuss about the topic, and I have prepared a few questions. The first question I would like to ask is, how can we enhance public trust in digital health? What are your ideas?
Start with this one because it's related to previous discussion. So when we talk about trust, we need to show the public about the accountability and responsibility of the healthcare providers, or everybody handle those kind of the services. One of the reason or one of the tools could be accreditation, because if you need to show the people you have
Victoria
the limit.
Charlie Nabedian. How are you?
Hello.
Good.
Okay, so I think that when some organization, they want to show the commitment to the public, or insurance companies or Ministry of Health or health authorities, this level of trust, you need to show them that you have some minimum requirement. You can show them that you follow some standards, and one of the tools could be following some acceptable international standard to show the trust. It's my idea. Thank you.
I would like to add to that actually. When we talk about the quality of the health services, I think it also is related to basic kind of context, because obviously when we talk about, like, when I have a family doctor, they know about my medical history, and then that is where they are able to basically provide very specific I think a prescription and very specific guidance with respect to what I need to do for my particular problem, right? But as we are moving towards digital platforms, I think that context would, or even when we talk about international, I think healthcare, I think that is where the context slightly gets lost in translation, or at times it's not even available. And that is where I think when we talk about healthcare data, we talk about silos. So even my healthcare data in United Kingdom is sitting across so many different organizations. And let's say if I travel to US, India, wherever, and if I have to get the right medical facility, I would struggle because my data is not traveling with me. And this is where I think the importance of having that borderless access of data becomes very, very important, right? Because medical care, the quality of the medical care is a lot of times driven by the patient history. And I think that is where I think we have to put a lot of focus with respect to how do we make this data borderless, interoperable, and then also how do I ensure that when I'm sharing this data is not going to get misused, right? And this is where the privacy, the concept of privacy and consent becomes very, very important.
Yeah, let me add to that. I think one of the things that I find, and I've worked with a lot of healthcare practitioners, we'll use emergency room physicians as an example, right? If somebody shows up to them and they're having different issues going on with them, but a patient, one, doesn't have their medical records with them, or two, doesn't have the ability to tell them what's going on with them, then what does an emergency physician do? He takes the most conservative approach to care, and that could actually be detrimental to the patient, right? And so what we have to do is we have to be able to allow different healthcare organizations to say your data can travel with you. Here is all the stuff you have, and take it with you, so that if you do travel to the UK or you go travel to India or Africa and something happens, you have the ability to show them what's going on, a medical record that travels, and they can enact care appropriately. And that's the thing. And right now what I find is, as we worked in South America and as we worked in Africa and India, physicians and different healthcare groups do not want to share the data because their always fear is, well, maybe the patient will never come back to me. They'll go to some other practitioner. Well, that's possible too, but isn't the purpose of it for the patient to be at the center and not for the healthcare provider to be at the center? And that's what matters most. If we really want to show trust, we give them what's theirs, let them go with it, and treat them the best we can. And if we do that, they probably will come back to us because we have shown them that we are trustable, right?
I love that. I have to play off that, because I think every phase of what we were just discussing in playing off that, when what we were discussing about prior to the pandemic and adoption of telemedicine, telehealth, and expansion, right? It was all about usability, all about actually the percentage of patients who are actually using the technology, and so on and so forth. But there is an element of providers, comfort with and with whether telemedicine or digital health products. And I think of things, and I said it before, sort of in the consumer context, as you say, what's going to drive public trust in digital health? Well, I think consumer convenience, which we were all just discussing, the ability to have your medical records, should you travel, should you be somewhere, that's going to drive public trust. It's just going to be an inherently comfortable with it, and accept that aspect of use of digital health products, and being more comfortable with it. Underlying that, of course, the Internet of Things, RPM, cloud-based solutions, consumers and patients, whatever they are, they're more focused on the appearance and the confidence of the security of your system, more or less, rather than how their data is going to be used or misused or aggregated data, in my experience and working in my clientele. So the security of that system is going to be a key factor in driving public trust, but I think more so it's going to be that consumer convenience driving adoption is just going to inherently drive public trust in using these resources to deliver that service no matter where they are. And those are my feelings on it.
Yeah, and let me add one more thing, right? But prior to the pandemic, telemedicine and telehealth adoption was slow. It was ridiculously slow in the United States for sure, and across the world. But with the pandemic, it forced innovation at such a quick pace that I've ever seen. So we jumped 10 years in a span of one, right? But along with that comes a lot of other things that we have to consider, right? We may be talking about like giving data over to our patients, right? But there also has to be a responsibility to the providers now, because they are going to have access to more data potentially than they ever did before. And so how do they enact on those decisions? Because again, I live in the US and we're a litigious society, right? And so if the data is not totally there, right, and a provider makes a decision based on what they have, then that could cause issues too. So there has to be a patient responsibility and there has to be a provider responsibility on now what you're getting, right? And that's important. And it's also the provider's responsibility to understand it on a telemedicine visit. Is the person I'm seeing exactly the person I'm seeing with all the data that comes with it, right? And so that's the whole purpose of having like, hey, one healthcare group has a different unique ID for a patient than another one does. How do we create, a consensus around that? How do we make sure that the data for John Doe is the same John Doe that comes from over there? So there's a lot of things that need to go on security and trust that we still have to work through. But both parties have to be involved to make it happen, right, in the end.
And actually, Aman, when you extend that to the example which Dr. Ali said, I love that idea, the picture that he painted with respect to Amazon. I think we are actually moving towards a marketplace, right, where we would have health providers, we would have pharmacies, we would have healthcare insurance providers, right? And I think this is where I think the challenges would increase, right, with respect to the security, the privacy, because now I think it's like I have my data, but then I have to share this data online with so many different parties because I need to get those services, right? And I think with that future in mind, I think we need to basically be very focused on data ownership, privacy, and consent, and so many other elements, right? And I think this is why I think this is one of the most important, I think, discussions that is going on in this industry.
Yeah, no, I agree with you. The other thing with it is like currently, I don't typically talk about our work, but we're working on a project because things are changing in the US on how doctors get paid, right? Right now it's been fee for service, and now we're actually going to what we call at risk, which is, hey, if you take better care of this patient, we'll actually pay you more, right? If you keep them out of the hospital, if you give them less medication, if you do all the things that are there, we're gonna do better. And so the only way to do that is to know what's going on with the patient, whether they've been in your clinic or whether they've been in any clinic or hospital across the country. And that's a huge daunting task to do. But if organizations are saying the health of a patient, which is proactive health, not reactive, matters, then every party has to cooperate, right? And so that's a huge thing, is how do we increase the cooperation between these different entities over time and say, hey, we're all in this together. And that's an important thing. And so we're working on a project right now where we provide data from wherever that patient has been in the United States. It doesn't matter what. And what they do is they take a look at it and they supply them a care coordinator who walks with them. That's where you have to go. And that's how you develop trust. If you don't do that, the patient will never trust you. And they inform them, we're getting your stuff from like everywhere you've ever been for the last 10 years. Are you okay with that? Because what we want to do is keep you out of the hospital. And most of them say yes, but we have to train them differently, because in other countries, people hold on to their medical records and carry them with them. In the United States, we give our trust to the doctors. We don't care what happens to the medical records or whatever. And we don't own them. And if you need to go get them, I have to pay for my own medical records to go get them from like 10 different providers, right? So it's a totally disjointed system on how we develop trust around this. But again, it should be a joint ownership. The patient should own it, but a patient should also lend it when it's necessary for use, right? So definitely see where you're going with that, Shiv. And yeah, the example of Dr. Ali is absolutely spot on, I think. So where we're headed.
Yes, I think this very useful discussion is especially important at this time. So our next question, I would like to ask, what are some of the opportunities and challenges encountered with self-sovereignty?
Let me start with that. So I think in the previous question, I think we kind of touched upon that particular topic, because I think when we talk about self-sovereignty, it's about ownership. It's very much tightly coupled with the concept of ownership, right? And within healthcare industry, I think that is a big question mark, right? And I think all of us agree on that point, that right now it's very fragmented. The data is not working because it's not traveling, it's not interoperable. And I think unless we make that data self-sovereign, in the sense like the patient has the complete ownership, but then they have, as Aman mentioned, that you should be able to lend it for specific purposes with respect to the consent. I think this is where a self-sovereign solution, identity or database solution, would be able to kind of take this to the next levels. And you can imagine a world where basically you're carrying your data in a wallet, right? So you have a digital wallet where you have all your health records. And then depending on the need of the hour, depending on who you are consulting for what particular purpose, you would be able to selectively disclose some of the aspects about yourself, right? Because I think there are scenarios where I might not be comfortable about sharing certain medical history about myself, or certain problems that I have. And this is where I think the selective disclosure becomes very important, right? And that is where I think a wallet driven approach helps a lot. And I want to give an example also. And this, I live in London, and I went to a pharmacy to pick my prescription. And because of pandemic, they started basically having those partitions, glass partitions, and you have to queue up to basically pick the prescription, right? And what they were doing is, like, you walk up to the counter, and then they would ask you to basically tell your name and your date of birth and your address, and you have to kind of speak that loudly, because there's a barrier, right, between you and the pharmacist. And there are people queuing behind you, so they can actually listen to your data. And this is happening in London, and you can imagine this happens all over the world, right? And this is where I think when we talk about a wallet driven approach, ideally I should have gone to the counter, I should have just basically using my phone, I should have sent some data to them, and then they would have approved it, and then they would have shared my prescription, right? So in that sense, I think we have all the technology at our exposure. It's just about driving the adoption.
Yeah, I think that also when we talk about these digital health services, we need to think about out of the countries and border. So the consistency of data entry and the data format could be another issue, if it depends on to who is the owner and who want to manage those data, and the integrity of data, because who want to keep those data integrated and then not touch and then change in the future, availability for other people. And then another things could be, again, the language. Different format of entries could be different. At the end you have a data file of the client, a patient file, and then none of the different sections talk to each other. Different for it's a lot of challenges. So I think the technically point of view that the people maybe they need to prepare a template or something that everything should be the same is a huge challenge. If you imagine that you visit during your 2-3 years 20 doctors in the 6-7 countries, if you have your data with yourself, then at the end the last doctor want to look at those content and they cannot understand what happened. Everybody put different format, different wording, different name of medication, and could be a huge challenge. So again, we need to have a standard, international standard approach. Otherwise the data is not useful. It's like different pages of a book, which each of them with different handwriting, different tone of the language, and different font. So when you want to read them, you cannot follow the process. Those are a lot of challenges for that.
No, I agree. One of the, I'm a big proponent of self-sovereign identity and self-sovereign, ownership of data. The problem is this, right? It's always going to be a problem in the fact that if I own the data, I could selectively tell somebody what I want them to know. And that's an issue, right? So if, let's say I'm a behavioral health patient, right? Maybe I don't want a provider to know that I have certain things going on with them, because if it gets reported to insurance may not cover me, right? Or they may put me in a different bucket, right? We worked on a project with the VA, and they have, you know, in the Veterans Administration of the United States, they do telemedicine, but they have high incidence of the opioid, you know, abuse, right? You know, and so they only get data inside the VA, but outside of it, they don't. But when they asked us to maybe provide it for them, we have to get permission from the patient. Well, if the patient doesn't give you permission, you don't know that a person has two different opioids at the same time. And so that selective, you know, permission is a problem in this space. And until we figure out a standard in which, if you're going to give permission, you give permission for all, or if you don't want to give permission, you don't give permission for anything, and it's your responsibility whether you receive your care or not. That's a totally different thing, and there has to be something that's done over time, in agreements that are made cross-border or even within borders or within healthcare systems that allows us to be able to share that. So I think you're always going to have a little bit of an issue with people wanting to give certain data and not others, and that could be a big hurdle to cross. It is already. So
yeah, my thoughts on that is that self-sovereignty for the concept of complete control, certainly in the US and anywhere else, it's not achievable. We have a system by which you have to share information in order to have services covered. You have obligations to report. Certain providers, you know, have obligations to report to public health authorities. So to maintain sovereignty over your data, I think it's going to be kind of situational, if you will, in certain data. Obviously, a digital wallet and being able to carry that information with you is a laudable goal. I think it would help for all of the reasons that all the other panelists have shared before. The notion is, and Aman, you were saying this, that trust by the provider that the data that they're actually getting is accurate. And that construct of being able to share that has obviously been a goal in the US and elsewhere for quite some time. I think we're going on 10 plus years of the notion of having, you know, a centralized system with health information exchanges and tons of money poured into it. And then lo and behold, right, you still have to have the individuals opt in, decide who they want to share that information with, who they don't. Then you now have interoperability issues and information blocking that we have to, you know, correct those problems because the market system wants to control who can have access to what. And those are all side thoughts to the actual notion of self-sovereignty of your own health data. How do you use it? Who do you share it with? But yeah, I mean, the notion of being able to control and grant permissions just doesn't work in the current framework because you want to go see someone, well, then you have to share that information to get it paid, like to have a claim paid. You have to have that, then the hospital or a provider or whatever that is needs to maintain a record of that and share it when they're audited, right? To say, yes, I did provide this service, I did deliver this service, right? And if you don't have a record of that, maintained it, then all of those payments can be recouped as overpayments. So it's not possible in the current construct for someone to have true, complete control to say, I no longer want you to have that information with related to the healthcare service or item that I received. And so those are clearly limitations on that concept.
Well, the other part of that, just to latch onto that, is information overload for the provider, right? You know, I mean, the thing about it is I've worked with health information exchanges, and you can go and ping a patient record, and one record I've seen before is 5,000 pages. If you're an emergency room doctor, what are you going to sift through, right? How, you know, when you have a certain amount of time, how do you figure out what's the most pertinent information if you're getting 5,000 pages from 10 different, you know, areas? And so even though HIEs were supposed to be the savior of putting it all together, what they did was they just gave it all to you and never put it in a contextualized manner that you could understand, right? So, and then it falls onto the provider too. It's like, well, if I miss something, am I liable for that because I had to sift through 5,000 pages, right? So there's a whole lot of battle that still has to go on. And I agree that sometimes, you know, yes, they need all the data, but sometimes data can be too much, right? You know, so, a provider one time told me that I am absolutely swimming in data. but I do not have the right information in front of me to actually do my job, right? And so those things come in
But
play.
that's where AI and machine learning come in, right? I mean,
it does.
Let's be fair. And the standard, Ali, what you were saying, the standardization of that information for that AI to actually work, to process all of that information and deliver it. And then you get into the liability of the developer of the, of that, and that's a fun topic that we're not talking about.
Yeah,
here,
that's a totally different. We could go down that rabbit because I've done that too. We've done data modeling and we've done data funneling and data transformation. But then they're like, wait, what if I miss something? What if the AI engine doesn't tell me that piece? And then am I liable, or is a software company liable for that? And that's a whole different rabbit hole to go down, right? So yeah, I get that.
That is a very important aspect, right? I think the key difference here, what we're talking about here is like, I think there's a key difference between data and information. And secondly, I think that is where the structure of the data and then the information processing matters a lot, right? And it has a lot of context with respect to what you're going to do with that particular data, right? And that is where it's always context-driven processing. And also when we talk about SSI, right, with respect to data ownership, sovereignty of the data, the granularity is also there, right? It's quite use case driven. Obviously, I think it would have certain limitations, but then I think this is where it needs to be augmented with other concepts and other technologies, right? Because when we talk about self-sovereignty, it's being created for so many other industries also, right? And that is where obviously one solution cannot fit all problems, but then, and that is where we need to bring the context about healthcare industry, the challenges that we are currently facing. But as a construct, I think it makes a lot of sense, right? Obviously, we would have to kind of bring a lot of context with respect to different scenarios. And then even within the healthcare industry, there are like kind of different areas, right? And then different ways of consuming information. So I think that is where I think the solutions would have to mature over a period of time to become very, very, I think, well adjusted to the ecosystem.
I think my summary would be, like, for the longest time, providers, right, practitioners have always been transactional, right? We don't have much time to spend, right, with our patients, right? So we become transactional. Data comes in, I take a look at it, I solve your problem, here's your meds, you go out, or here's your test and you go do it. What really data should be doing, right, is when I receive it, you need to understand why something's going on with you because of what I'm seeing. You need to understand why I'm doing something for you or with you, with your permission, because of what we're seeing together on this test or this, whatever you have, right? Whenever we do that, that's when data is the most powerful, right? Stop being transactional and start being transformational with your patients and be able to do something with them where they're involved in that process. And when they do, they'll understand what their data means. Right now, they don't, because all we use it for is a transaction. Right?
Yes, thank you to everyone for this very interesting discussion for such an important topic in digital health. I'm sure this has been really helpful to all participants of this conference.